Hello, thank you so much for joining us for the home care tips session today. My name is Madeline Goldfarb, and there are three other members of my team named Blanca Hernandez, Sindhuja Devarajan, and Valeria Urbina. We're all second year medical students at Foster School of Medicine. This is an overview of the topics that we'll be covering in today's session. We will talk about 7 topics, including how to identify symptoms of COVID-19, taking care of a loved one at home who may have COVID-19, and how to prevent COVID-19 during daily activities. You've already heard from other teams today, so you know just how important it is to stay as healthy as possible. I want to start out today's session by making sure that everyone is able to tell the difference between mild and emergency symptoms of COVID-19. Let's see what everybody already knows. So, should you monitor at home, or is it an emergency if somebody has a cough? If somebody has a cough, that is not an emergency symptom in and of itself. It simply means that somebody is having trouble breathing and is coughing a lot. So just if somebody has a cough, they are able to monitor at home. How about if somebody loses their sense of taste and or smell? Is that an emergency symptom and someone needs to go to the hospital, or is it a symptom that can be monitored at home? It's a symptom that can be monitored at home. It is actually very unique to COVID-19. However, it is not an emergency symptom in and of itself. Lastly, should you monitor at home, or is it an emergency if somebody has chest pain? Chest pain actually is an emergency symptom. The chest pain may or may not be related to COVID-19, but regardless of its cause, it is a reason for serious concern and should be treated as an emergency. If you are unsure about the level of care you or your loved ones may need, go ahead and feel free to use the CDC Selfchecker to help you decide your next steps. To do so, you go to the CDC website that is shown at the bottom of the slide in the red box. And a chat box will pop up on the right side of the webpage where you can answer questions as part of the self-checker. Here, the self-checker has asked me where I am located, if I'm answering for myself, and if I'm experiencing any of the emergency symptoms from the list. As you can see from this example, I am portraying symptoms that are an emergency. So the CDC Self-Checker is suggesting that I go to the emergency department. Remember that at any point you can also always call your doctor or set up an appointment, but this is just a great resource for you to have in case you have any questions. So, first question, what if you're not sick but someone at home has tested positive and they only have mild symptoms and we're told to stay home? How should we take care of them? Once you've identified that someone in your household has symptoms of COVID-19 or has tested positive, you'll want to safely take care of the person who is sick and do your best to prevent other members of your household, including yourself, from getting sick. If possible, have the person who is sick stay in a room away from other members of the household. Minimize contact with the person who is ill by having a designated person who will enter the room to give meals, water, and medication. Always wear a mask when interacting with the person who is sick, and also have them wear a mask when you enter the room. You'll want to have assigned utensils, plates, towels, and bed linens that are only used by the person who is sick. If you are doing laundry for somebody who is sick, do not shake clothes when you're handling them, and be sure to use the warmest setting on the washing machine. If the person who is sick is sharing a bathroom or other shared spaces with other household members, you will want to regularly clean those spaces after using them. So what surfaces should we clean regularly? Some surfaces that should be regularly cleaned are doorknobs, countertops, toilet flushes, light switches, phones, computer keyboards, faucets, Anything that we are touching very frequently throughout the day. You will want to use soap and a water mixture to clean the surfaces. This will reduce the number of germs and clean dirt on surfaces. Then you will disinfect with a common household disinfectant to kill the germs. While most common household disinfectants are effective to use against the virus that causes COVID-19, you can actually double check by looking up the EPA registration number on a database that tells you whether your disinfectant is effective for COVID-19 disinfection. If you look at your bottle of disinfectant, you will see a number that's pretty small and says EPA reg number, usually near the instructions for safety and storage. When you go to the EPA website to look up effective disinfectants, you will see a page like this one and a hyperlink that says search by EPA registration number. If you click on that, you will be directed to a box where you will enter the EPA registration number from your disinfectant product. The search results will show up on a table like the one below and tell you the ingredients in your product and what directions to follow to kill the novel coronavirus. And so what if you don't have disinfectants at home, but you've got bleach lying around? You can actually use household bleach cleaning solution that is pretty easy to make at home. You would add 5 tablespoons of bleach to 1 gallon of room temperature water and leave it on surfaces for at least 1 minute for maximum effectiveness. You will want to make sure that you check your bleach for a sodium hypochlorite concentration of 5 to 6% and that it has not expired. Most importantly, limit the contact with the person who is sick. Thoroughly and regularly clean shared spaces and stick to physical isolation guidelines. These are all important ways to protect members of your household while caring for someone who may have COVID-19. Be sure that all household members limit contact with the people outside of the home to prevent spreading the virus to others. And now, how would you treat someone with COVID-19 at home? With everything else being said, if you or your loved one begin to experience any of the mild symptoms that have been previously mentioned, you should physically isolate for at least 10 days until symptoms resolve. Go ahead and stay home and call a doctor for further guidance. Most people, again, will only develop these mild symptoms and will be able to recover from the comfort of their home. If you do have mild symptoms, your doctor will recommend that you or your loved one rest, eat healthy foods, and drink plenty of fluids. Additionally, pain relievers such as ibuprofen and acetaminophen can be used to alleviate symptoms. You can choose acetaminophen to relieve mild symptoms. For regular strength tablets, you would take 2 tablets every 4 to 6 hours. Be careful and do not exceed more than 6 tablets per day because you just want to prevent any sort of liver damage. And if you're giving medication to children, make sure to talk to their pediatrician before any appropriate dosage is given. Now, if you opt to use ibuprofen, then make sure to take 1 to 2 tablets every 4 to 6 hours and do not take more than 6 tablets in one day. And please drink a full glass of water with the tablets to decrease the risk of an upset stomach. Monitor the progression of symptoms in yourself or your loved one. If your symptoms worsen, then call 911 and alert medical responders that you or your loved one may have COVID-19. Per CDC guidelines, if your symptoms subside and it has been 24 hours since you had a fever and 10 days since you first showed symptoms without any sort of a cough or shortness of breath, then you or your loved ones can begin to be around others. We know that being a caregiver can be stressful, and all of these suggestions and guidelines can be demanding. Please make sure that you take care of yourself and consider checking out the other module that has been uploaded on dealing with stress during COVID-19. I know that we've all been hearing a lot on the news about different treatments, and it's all really confusing. Is there really any sort of a treatment? While we're learning more about the virus and continuing to research it every day, There is currently no FDA-approved treatment or cure for COVID-19 for home use. It is important to take care of yourself or a loved one in similar ways that you would with other illnesses. Drink plenty of fluids, get rest, and nourish your body with food. If you or a loved one does have to go to the hospital for additional assistance, the hospitals have created special protocols for ways to best help. They will place the individual who is infected in a room with a special air system and provide oxygen to help with breathing. They may also give medications to help the person who is infected feel better with their symptoms. Someone who has a severe case may be placed on something called a ventilator or a breathing machine. There's a photo of one on this slide. And this is just to help provide the most oxygen possible to that person's lungs. Healthcare providers may also speak to someone with a severe case or their loved one about 3 different treatments that have been approved for the FDA to try. These include medications called remdesivir and dexamethasone, as well as convalescent plasma. The plasma comes from people who have already recovered from the coronavirus and is given to those who are currently infected, based on the theory that it can enhance their body's capacities to fight the virus. We've all heard a lot of information about what causes COVID-19 and how to prevent it. Let's address fact from fiction. We're constantly being presented with information regarding the novel coronavirus through social media, TV news reports, family, and friends. And although staying informed is beneficial, it's definitely important to try to distinguish myth from fact. We're going to go over a few statements to try to decipher what is true or false. So, true or false, antibiotics can cure COVID-19. False. Antibiotics treat bacterial infections. And because COVID-19 is a virus, antibiotics are not an effective treatment. There's no medicine currently proved to treat or prevent coronavirus. True or false? Wearing a mask causes carbon dioxide intoxication. This is also false. Prolonged use of masks are definitely uncomfortable, but it will not lead to oxygen deficiency or carbon dioxide intoxication. True or false? Thermal scanners can detect COVID-19. This is also false. These scanners are used to detect if a person has a fever, which is a common symptom of COVID-19. However, it is possible to have the virus and not have a fever. True or false? Drinking alcohol will protect you from COVID-19. This is false. Drinking alcohol excessively to prevent COVID-19 can be dangerous and can instead cause any other health concerns. True or false? Introducing bleach or any sort of disinfectant into your body will protect you from COVID-19. This is false. Consuming bleach can be fatal, so please be careful not to do that. True or false? If you are able to hold your breath for more than 10 seconds without pain or discomfort, you are free from COVID-19. This is also false. It is not an effective method of detecting the virus. The best way to detect the virus is with a lab test. Another question is that I've heard that from a lot of people that you can get COVID-19 from your food and touching your mail. Let's see if this is true. There are a lot of activities that we take part in regularly, like buying and cooking food and checking our mail, and a lot of people are not sure how the novel coronavirus affects our day-to-day activities. Let's start by talking with food, because let's be real, that's everybody's favorite topic. There's currently no evidence that the novel coronavirus is spread by consuming food. So please do not wash your produce and groceries with soap, disinfectant, or alcohol. This can lead to ingesting dangerous chemicals and is really unsafe. The safety of soap and bleach on produce has not been tested, and the safety of ingesting these products are not known. Vinegar thus far has not been shown to kill the virus. The rubbing action of washing is actually the best method of dislodging droplets that might contain the virus. Practice general food safety methods like cooking food to the recommended temperatures and washing your hands with soap and water for 20 seconds before and after handling food items and packaging. Now, how about checking the mail? Can you get COVID-19 from handling your mail and packages? There is evidence that the novel coronavirus that causes COVID-19 can be detectable on cardboard for up to 24 hours. If you receive a package, leave it outside for a few hours. You can also spray it with disinfectant before handling the package. Dispose of the outer packaging as quickly as possible and make sure that you wash your hands with soap and water for 20 seconds immediately after you handle any packaging or envelopes. Now, I know that we've all been cooped up at home and have barely left to do anything. Is it time for us to start getting back to running errands and having fun? While the best way to avoid exposure is to stay home and only leave for essential activities, we understand that that is not always possible. With months of quarantining and the reopening of businesses, you might be looking for ways to resume some of your daily activities. We would like to provide you with some tips for safely engaging in these activities. So let's first discuss the different types of activities. There are essential activities or errands, which consist of going to the grocery store, pharmacies, doctors and dentist appointments, gas stations, banks, places of worship, schools or classrooms, and using public transportation. Be sure to stay home if you are sick, except for visiting a doctor or a hospital, of course. Always wear a mask and maintain 6 feet of distance away from other people when you're out. Remember that close contact is within 6 feet for 15 minutes with somebody who has COVID-19 or who has symptoms of COVID-19. Limited ventilation in rooms or public transportation is the reason why we should keep masks on at all times indoors and even outdoors when we cannot stay 6 feet apart. Air purifiers and fans may disperse droplets that contain the virus further. So, if you are using them indoors, make sure to continue wearing a mask. Take advantage of convenient online shopping and takeout options. And of course, use hand sanitizer after leaving an activity and wash your hands with soap and water when you're back home. Then, there are personal and social activities, which can further be divided, actually, into indoor and outdoor activities. Indoor activities include the gym, restaurants, and social gatherings. The guidelines for indoor social activities are very similar to those for essential errands. In addition to wearing a mask and maintaining social distance, you will also want to ensure that the gym or restaurant you're visiting is adhering to COVID-19 cleaning and safety guidelines, like limiting the number of people in the establishment, regularly cleaning tables and workout equipment, and keeping patrons 6 feet apart. Regarding outdoor activities, these might include travel, parks, and sports. Here are some tips that can help you keep you and your loved ones safe. If you are not able to maintain the 6 feet distance, keep your mask on at all times. Check with state and local authorities if parks, hiking trails, swim areas, or recreational facilities are open before heading out. This is because National Park Services are deciding on a park-by-park basis if a national park will open. If you are traveling, take your own cleaning supplies to the hotel and disinfect all frequently touched surfaces, like the light bulbs, switches, doorknobs, sinks, faucets, remote controls that we were talking about earlier. And to learn if a hotel is following safety protocols, make sure to check out its website or call before heading out. To conclude, please take the necessary hygienic precautions that will allow you and your loved ones to be safe during this pandemic. Thank you for listening to our presentation, and we hope you found the information we have given you very useful. If anyone has any questions, feel free to contact us through our website and feel free to submit any questions to us and we will get back to you. Thank you so much for attending today's session.